Good morning, everyone. Welcome to the second day of the Hidalgo County Wellness Program 2021 Virtual Wellness Fair. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm super excited that you're here with us today in this second day. Before we get started, I want to make sure that the technology is working for us. So if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located at the bottom of our Zoom webinar software. Again, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located as part of our Zoom webinar software. Thank you so much. It looks like we're good to go technology-wise. I do have a couple of reminders before we get started. Reminder number one is that we still have 5 presentations as part of our 2021 Virtual Wellness Fair. Therefore, if you haven't set up a reminder for those or any of our upcoming webinars as part of the Wellness Program, I invite you to do so through our Wellness Program website or our Wellness Program Fair website. And the second reminder is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum at the bottom of our Zoom webinar software throughout the presentation, and we will answer them at the end of the presentation during the Q&A session. At this point, I have the pleasure of introducing today's guest speaker, Ms. Diana Salinas. Diana Salinas received her bachelor's degree in environmental science from the University of Texas, Rio Grande Valley in 2019, where she studied food relationships and organic agriculture. In 2021, Diana graduated with her Master's of Public Health degree with a concentration in health promotion and community health science from Texas A&M University. Through this program, she received a certification in health coaching in chronic disease. Diana has worked on multiple community projects in the Rio Grande Valley concerning food insecurities and promoting healthy lifestyle. Diana is now working for the Hidalgo County Department of Budget and Management as the Hidalgo County Wellness Program Coordinator. Diana, thank you so much for being here with us today.
Thank you so much for having me. Looking forward to presenting. Thank you. I'm going to go ahead and share my screen then.
Yes, absolutely.
Thank you. Okay, does that look good for you?
Yes, everything is working perfectly.
Okay, great. All righty. So thank you so much for joining us today, everyone. I hope this is an informative presentation. And I do want to start off with saying that I am looking at this, or I am presenting this information to you from the perspective of a health and wellness coach. So if you do have any, we will have a Q&A at the end of the session. However, if you do have any questions that are more on the clinical side, I do advise you to consult with your doctor and your general practitioner about those. So thank you so much, and let's get started. So what is breast cancer exactly? It is a common cancer that mostly affects women. However, it does affect men also. And it is one of the more common cancers in the world, affecting with actually more than 230,000 new cases being diagnosed every year. So like I said, women do make up that larger portion because in fact, only 1% of all male breast cancer diagnoses are male. So it does affect women on a larger spectrum. So however, that doesn't mean that the male cases are any less important, and they all need to be handled, with an extreme level of caution. So what is exactly breast cancer, right? It's caused by a cell mutation of the breast tissue. And so these, what happens is you have a normal growth pattern of breast tissue cells, and they develop to a certain age, and then they'll multiply throughout, their lifespan. Some of them will die off, but they do, generally replace each other at a regular speed, you could say. However, if there is a mutation in a specific cell, which some of those can be genetic, then that can create an abnormality. And those abnormal cells start rapidly multiplying, and that can cause a tumor to form. And grow there in different parts of the breast tissue, which I'll go into soon. So yes, so it's pretty interesting, I think, how rapidly those cells can grow to create the tumors. So what kind of tumors are there? There are two specific types of tumors that are found in the human body. You have benign, which are non-cancerous. And so this can be, you know, a compounding of cells that can look cancerous, but once a biopsy is done, then it can be determined whether it is benign or not. And then you have another type, which is malignant, and those are the cancerous types of tumors, and those can be determined again by a biopsy. And breast cancer is classified by a malignant tumor in or around the breast tissue. So those, the only types of cancerous tumors that you'll find, those are going to be known as malignant. So now we can move on to the types of breast cancer. So these are just a few types of breast cancers that I have here listed today. Normally, there is a much longer list that is, you know, quite extensive. However, these are going to be the more common ones that I'll discuss with you today. So the first two that you'll see are ductal carcinoma in situ and lobular carcinoma in situ. So the in situ part simply means to stay in the same place. So that means that the carcinoma at this point, which is the cancer, is not spreading anywhere, and it is pretty collected in only one area. And these are found in the very early signs of breast cancer. So, and that is the most common, like the highest number of cases are going to be carcinomas in situ, which is good because that means that you have a higher chance, you know, of recovery when it is still localized. Now, moving on, we have these two invasive carcinomas. So you have invasive ductal carcinoma and invasive lobular carcinoma. With you see the words ductal. So what does that mean? Ductal means specifically on the lining of the milk ducts that then spreads into the breast tissue outside of that duct. So with ductal carcinoma in situ, that means you already, even though it is at an early stage, there is a very, very high probability that it will spread out into the breast tissue. Now, once it's already in that invasive ductal carcinoma stage, then it has already spread. And meaning, you know, with that word invasive, we know that it is already spreading. Then we have the invasive lobular carcinoma, and lobular means where it starts in the milk producing glands, and those are known as lobules. And with the invasive lobular carcinoma, that means that it is spreading to other regions of the breast tissue, which means that it has already progressed. So then we have these three other types of breast cancer, which, and we have inflammatory breast cancer, which physically presents itself as making the skin very hot, very warm, as well as very red. And you'll also notice swelling in the area, which is where we get the inflammatory word from. And then it can also present itself by dimpling the skin. So that's going to be very hot, very red, and swollen, you know, very abnormal, right? So the next one that we have is Paget disease of the breast. And Paget disease of the breast presents itself only within the nipple of the breast. So it will not spread outside of that. And Paget's disease is specifically concentrated with cancerous cells surrounding the nipple. Phyllodes tumor it's when you have multiple tumors within the breast area, and they originate in the connective tissue. So that allows them to spread out and present themselves in a leaf-like pattern. So again, these are a few of the types of breast cancer, but there are, you know, other types as well. Oh, and as well, one last thing was most of cancers you're going to have 8 out of 10 invasive breast cancers are ductal, excuse me. And so whenever you do have an invasive cancer, majority of the time it is going to be a ductal carcinoma, while 1 in 10 of the times you have an invasive breast cancer, it'll be lobular. And we can see those that ratio again because most of male breast cancers are going to be, if they are invasive, then they're the invasive ductal carcinomas as well, not the lobular. So lobular is more rare, you could say. So now we'll go into some classifications. So these are 2 different types of classifications that you will find when explaining where you are at in, or where a person may be at in their stages of breast cancer. So like I stated earlier, where we saw carcinoma in situ, that is very early stages. However, it can progress. And this table goes all the way to recurrent or relapsed, meaning that the cancer has already progressed or it has returned after receiving that initial treatment. And I feel like these stages are kind of what we're normally used to hearing, which would be stage 1, stage 2A, 2B, 3A, 3B, and then we have the inflammatory, and then stage 4. And these are characterized specifically by the size of the cancerous tumors and how far they have spread throughout the body or spread throughout the breast tissue. So we can see, it ranges between less than 2 centimeters all the way to more than 5 centimeters on stage 3A. And then at stage 4, meaning it has spread to other locations within the body, and it can even affect your liver, your lungs, and your bones as well. So this is one way to classify breast cancer. Another way that it can be classified, and this second one is called the Seer table. So that is SEER. And it is classified as localized, regional, and distant. So localized, meaning that the cancer has not spread outside the breast. Regional, meaning the cancer has spread to nearby structures or lymph nodes, so still within the chest area. And distant, which means that the cancer has spread to other parts of the body. Okay. So let's look at some of the symptoms, and this is going to be specifically in women. So you can have usually it presents itself as a lump or a thickening of the breast tissue. Then other changes can be to the skin around the breast area. And this is what I said earlier with that inflammatory type of breast cancer, which presents itself as redness, as well as dimpling. And in other cases, you can have scaling of the skin as well. So it's always best to make sure that we identify any changes to our skin in our chest area. Changes to the nipple, which could be inversion, pain, redness, or scaling again. So it's not just going to be, a lump or maybe what we're used to knowing as signs of breast cancer, but it can also be changes to the skin and changes to the nipple as well. So it's always good to be aware of our bodies and how, what's going to be abnormal. Next, another thing that is a symptom is discharge from the nipple other than breast milk. So anything that is odd color or maybe blood, we want to make sure that we are getting that checked out immediately. And then lastly, we have swollen lymph nodes. Now your lymph nodes in the chest area can be found in your underarm region or on your lower neck region. And you'll know that they're swollen. They might become slightly painful as well. So anything like that, you'll always know that your body is, fighting off something if your lymph nodes are starting to react in this way. So of course, it's always best to talk to your doctor or talk to your general practitioner regarding any symptoms if you are, feeling that you may be presenting some of these. So yes. Next, we have symptoms in men. So you'll notice that all of these symptoms are actually the same. So the way that these symptoms present in men can be the same with the lump or thickening of the breast tissue, The same with the changes to the skin around the breast area or chest area with redness, scaling, or dimpling. Same thing with the nipple, the inversion, pain, redness, or scaling, and discharge, as well as those swollen lymph nodes, which would be in the underarms and lower neck region as well. So generally speaking, what I had previously stated was, physical symptoms. However, there's so much more that comes with breast cancer than just those physical symptoms, which are already, very difficult to handle, right? So along with, and I really like this graphic because I think it really presents, everything else that comes with dealing with this cancer. So people with breast cancer may also deal with, anxiety, pain, hot flashes, depression, definitely fatigue. So there are many, many symptoms that, generally are not talked about and that many people may not realize come along with, having to handle a diagnosis such as breast cancer. And again, please talk to your physician if you are, nervous or notice any changes in your body or in your chest or breast area. So looking at a prognosis, the top chart here uses the SEER stage, which we spoke, which you saw in our previous slides, which is that classification table below. And in the in the first column, we have that which is localized, regional, and distant. And in the second column, we have the 5-year relative survival rate. And so that is for the different classifications of breast cancer. So for localized, which is where cancer has not spread outside of the breast, we have 99%. For regional, where cancer has spread to nearby structures or lymph nodes within the breast and chest area, we have 86%. And then with the distant stage, where cancer has spread to other parts of the body, we have a 28% rate there. So this is, again, just a general overview, and every single case is different. So, you never know how one might handle the disease or be able to, continue on after being diagnosed and, after treatment as well. So speaking of treatment, we have a few, again, these are just a few of the options that are provided. Again, the most common ones I have are going to be listed here. So generally, when a tumor is found in the body, one of the first options you could say would be surgery. And this does allow for the most immediate change, which is removing the tumor and or cancer cells that are in the breast area. Then we have chemotherapy, which in the description, it is on the lower left-hand side. And chemotherapy uses medications that travel in the general area of the cancer, although they do affect, the entire body. So, and after surgery, of course, we want to consult with our doctor to determine what path to take next. And obviously we are consulting with our doctor throughout this entire journey. So next would be radiation therapy. And radiation therapy uses waves of radiation that cause small breaks within the cancer cells. And that keeps them from growing and ultimately killing those cancer cells. So it is, maybe a harsh kind of treatment with that radiation, but it has, proven to be successful in different cases, correct? So next we have targeted therapy, and targeted therapy focuses on, we have our little graphic here, and so you can see that it's specifically targeting the cancer cell. So meaning that it specifically targets cancer cells within the breast tissues rather than kind of treating the body as a whole, if that makes sense. Next, we have immunotherapy, which uses the body's own immune system to fight off the cancer, of course, with the doctor's guidance again. And then we have hormone therapy, which uses hormones to kill cancer cells that have specific receptors. And those receptors attach to estrogen or progesterone. So they'll use estrogen and progesterone to fight off the cancer in that way, because if the cells have those specific receptors that they attach to. So very interesting. Again, we have advanced a lot in our treatment options. But again, definitely always with the guidance of your doctor or general practitioner. These are some of the ways that breast cancer can be treated. So next we have prevention, and I think it's very important to know your risk factors because there are quite a few of them for both men and women. So, but the general, and again, this is a shortened list, but there are quite a few risk factors that can go into whether or not you are at a slightly increased risk or a severe risk increase, okay? So first we have generally, or I guess more plainly, being born a woman does put you at a higher risk for getting breast cancer, as well as age. Generally, if you are older and a little bit lower, I have going through menopause after 55. So if you are of an older age, you are starting to increase your risk of getting breast cancer. So we'll go over preventative measures in a bit here, but I want to make sure I stay on this topic. So next would be inherited genetic mutations. So this does not mean that just because your mother had breast cancer that you are going to have breast cancer, but in certain cases, there are genes that are passed down. And if those genes and cells mutate, then, that definitely puts you at that more kind of severe increased risk. So, and those cells specifically are the mutated BRCA1 and mutated BRCA2. Then again, I did mention the going through menopause after 55. This puts, a lot of different changes into a woman's body that can, perhaps cause some of those abnormalities to form. Next would be the family history of breast cancer, and then having dense breast tissue as well. So these are just a few, but I think, maybe some common ones. And then as well for men, the age is a big risk factor. Once men start getting, past that 55 age as well, they are at an increased risk. As well as having the dense breast tissue or having a family history of breast cancer. So some of these are interchangeable between men and women. Some of them obviously only affect women more, but yes. And so then we have the preventative measures, which are genetic counseling and testing, which is very important. And then for those at a more severe increased risk, we have frequent doctor's visits, and then medications to lower that risk or preventative surgery. But again, those are for more severe risks. So next we have a self-exam for him. So this would be good to check yourself the same day every month. And this allows you to follow step-by-step instructions on how to properly check yourself when for breast cancer. So when you can do this, or you should be doing this both standing up and lying down, and then using your 4 fingers and that the pads of your three middle fingers, lightly press around the breast tissue in a circular and up and down motion to find any lumps. And then it's the same for women, the same standing up and lying down and using those 3 pad fingers to lightly press around the breast tissue up and down and in circular motions to see if you will find any lumps or abnormalities. And then lastly, I wanted to talk about lifestyle. There are certain things that you can do in your life to reduce the risk of getting breast cancer. So the first being reducing alcohol consumption. Alcohol consumption has been directly linked to putting you at an increased risk for getting breast cancer. being overweight or obese, specifically after menopause, because after menopause, the fatty tissue does increase the progesterone hormone, and that itself can cause an increased risk for abnormalities. And then lastly, increasing physical activity. And I don't say this specifically for losing weight. However, physical activity can help reduce inflammation in the body and can help regulate hormones and energy levels, energy imbalances within the body, which is very important just for our bodies to be balanced and feeling our best. And I also encourage you to visit our healthy aging presentation at 1:30. I believe it's at 1:30 today, to learn more of these healthy lifestyle tips as well that can help you in your everyday life. Thank you so much. I hope you all enjoyed the presentation. And I believe we have a Q&A now.
Thank you so much, Sienna. I really appreciate you taking the time to being here and to sharing this information with us. As you mentioned, we are talking from a health coaching perspective, so we definitely want to remind our employees and our attendees to make sure that they visit with their physician for any additional information, and especially for clinical information. But at this point, I'm going to go ahead and share my slides. That way we can go ahead and start with the Q&A session for this presentation.
Okay.
Perfect. So the first question that we have is, does a family history of breast cancer put someone at a higher risk?
Yes, a family history of breast cancer can put someone at a higher risk. It does not always mean that you will get breast cancer, though. That's why it's always best to consult your physician, go to your yearly checkups with your general practitioner, and make sure that you're taking the steps to not be at a higher risk. Although because you are at a higher risk due to your family history, you want to make sure that you're not pushing that any further as well.
Great, thank you so much. And the next question that we have is, what is the recommended age to get a mammogram?
That's a great question. I believe the recommended age to get a mammogram, if you are not at high risk, is about 35. And however, if you are at an increased risk, that number does go down. So when you are younger. I'm not quite sure exactly what that number is for the increased risk, but yes.
And if I can just add to that question, Diana, I know that based on the United States Preventative Service Task Force, which is the one that help us determine what is the age that we need to start taking those screenings. It does vary, like Diana mentioned, depending on the age risk, but of course, for women from 50 to 74, we do need to do it every 2 years. And from women 40 to 49, it is recommended to talk to your health provider to make sure it is recommended, or how often is recommended based on your risk factors like Diana was mentioning.
Thank you.
And then the next question that we have is, what puts men at risk for breast cancer?
Men can be at risk for breast cancer through a history of having a family history of breast cancer, having thicker tissue in the chest or breast area, as well as age. So once a man becomes older than 55, they are just at an increased risk. But again, the number for a man getting breast cancer, or the rate is 1% of all cases of breast cancer. So the numbers are low. However, it is always important to be aware of some changes that our body may experience, and how we should address those by visiting with our physician.
Thank you so much, Sienna. The next question that we have for you is, how often should one do a breast self-exam?
Somebody should do a breast self-exam once a month, especially if you are at an increased risk. You can do it more often than that. Generally, it is good to do it laying down and standing up, so that way you are able to feel the tissue in the best possible positions. But yes, generally it is for people who are not at an increased risk. Just generally speaking, even then once a month is a good time frame. Mm-hmm.
Perfect. Thank you so much. The next question that we have is there any type of support groups or counseling that are covered under the county's insurance for someone who might be dealing with stress of being newly diagnosed?
Absolutely. That is a great question. So the county does provide counseling sessions through the Employee Assistance Program, and that is through Deer Oaks. So we can provide that information to you. Actually, there is a Deer Oaks Employee Assistance Program booth in the exhibit hall. So you can actually visit their booth and see some of the services that they offer, and also perhaps ask or inquire about their counseling sessions as well. Thank you for your question.
Yes, and we also want to remind employees that they also have an on-demand presentation. So it's not a live presentation. However, you are able to go throughout the day and watch that presentation. So with the Deer Oaks, it's actually Greg, who is one of our directors for webinars and presentations from the Employee Assistance Program. And he hosts a presentation regarding all the services that are covered under the Employee Assistance Program. So we definitely also encourage you to watch that recorded presentation. And of course, as Diana mentioned, visit the booth as well. And with counseling, we also have additional counseling that is provided under the county's medical insurance. And that's going to be for more long-term. So if it is short-term counseling that you would like to discuss it with a licensed counselor, definitely the first point of contact should be the Deer Oaks Employee Assistance Program. However, if long time is needed and your physician believes that that's something that is recommended by them, then there's definitely additional options to your medical insurance. Also, adding just one more thing, Diana, if I can, to this question, we do have counseling and genetic counseling for patients only for ovarian cancer and breast cancer. So that is a benefit that is covered under the county's medical insurance as well.
Thank you so much, Diana. That was great information.
Thank you. Now, the next question that we have is pain in the breast area a sign of cancer?
So yes, to answer that question, yes, pain in the breast area is a sign of breast cancer, but that doesn't necessarily mean that if you have pain in your breast that you have breast cancer. So although it is a symptom, I would advise you to consult with your physician if you are feeling pain in your breast area, so that way they can do further testing to confirm or deny.
Perfect. Thank you so much. And well, it looks that we have covered a lot of the questions. I know we do have additional questions, but we do have time for one more question. And the question is, I did not see stretch mark as one of the signs. Is that still something we should look for?
Throughout my research, I didn't see stretch marks as being a sign of breast cancer. So I wouldn't necessarily see it as something to be alarmed by, considering, as far as I know, that they are relatively normal to have. However, again, I do advise, if you do find that they are maybe abnormal, or you do feel like something is not right, then definitely consult your physician to further conclude that.
Absolutely. Well, thank you so much, Diana, for this presentation. Thank you, everybody, for joining us. I do want to encourage everybody to join the additional presentations that we have this morning and this afternoon. And of course, also to visit the exhibit hall. We are going to be doing raffles for everybody who visits the different booths that we have available and connects with our reps. So definitely, I do encourage you to do that and watch, of course, our on-demand presentations. All of the presentations that were hosted yesterday are already available on demand, so you can definitely go back and take a look at those in case you miss any of those. Thank you, everybody, for joining us. Stay safe and stay healthy. Have a beautiful day.
Thank you.